love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience, and in with this week's edition of Health Matters is your host, Shevanee Nisbett, Health Educator from the Health Promotion Unit. Today, March 24th, is World Tuberculosis Day, and the theme for this year is Reach, Treat, Cure Everyone. To bring awareness to the day, I have here with me Dr. Judy Nisbett, Medical Officer of Health in Nevis, as well as Nurse Jeffers, who is Community Nurse Manager in Nevis at the Charlestown Health Center. I have them here with me today to give us some insight on tuberculosis, as well as for later on in the show you will see inside the lab of what happens for testing of tuberculosis and diagnosis of tuberculosis. So welcome Dr. Nisbett and welcome Nurse Jeffers.
Thank you.
Dr. Nisbett, what is tuberculosis?
Okay, tuberculosis is an infectious disease caused by mycobacterium, and there are different types of mycobacterium. There's Mycobacterium tuberculosis, Mycobacterium bovis, Mycobacterium africanum, Mycobacterium capri, and many types of mycobacteria. But the one that is most important to us is Mycobacterium tuberculosis. Now, Mycobacterium tuberculosis has different names. Right. We know it also as Koch's disease, and that is, it was named after the researcher who found the bacteria. He isolated the bacteria. Mycobacteria tuberculosis was causing devastating like death and illness back in like the 1800s, and he's the one who isolated it, and in fact he got a Nobel Peace Prize for it. So it's named Koch's disease also. Some persons on Nevis may know it as consumption because it used to be called consumption, and I guess it's because of the terrible weight loss that it causes if it's untreated, and the hacking cough that comes along with it if it's untreated. So we have different names for it: TB, tuberculosis, Koch's disease, consumption, colloquially. Right? Now, like I said, the most important of those organisms that I spoke about is Mycobacterium tuberculosis. And there are different types of tuberculosis depending on what part of the body is affected by the germ. So the germ can affect the lungs, it can affect the bones, it can affect the brain, it can affect the heart. Okay? But the most important one for us is pulmonary tuberculosis, which is infection of the lungs. Okay, so when we talk about tuberculosis, most times we mean pulmonary tuberculosis because we hardly ever see the other types of tuberculosis. So almost 100% of tuberculosis is pulmonary tuberculosis.
And that's worldwide or just in the region?
Worldwide.
Oh, okay.
Worldwide.
Okay, and how is tuberculosis contagious? Like, how is it contagious?
It is contagious. It passes from one person to the next, but it's through coughing. Okay, so we're talking about pulmonary tuberculosis. When a person coughs, the bacteria is enclosed in tiny droplets. So that cough with those many droplets would have bacteria in them, and if a person breathes that in, that person can become infected with Mycobacterium tuberculosis.
And how soon after they're exposed to it are they considered infected?
Well, they can get infected right away. Wow. But the interesting thing about tuberculosis is that if you're infected with tuberculosis, you may not show any symptoms. So you are infected, and the body, if your immune system is strong, can wall off the germ and fight that germ, but that germ is still in the body, so it's just walled off. It's not multiplying. The germ is not multiplying, but it's there.
Okay.
So it's important to know that that person is infected with the Mycobacterium tuberculosis, but is not showing any symptoms. Okay. Now the other part of that is that person now can go on later on in life to get the disease, which is the full-blown disease with coughing, night sweats, fever, weight loss, loss of appetite, fatigue, all those symptoms of tuberculosis. So that person who has been infected can later on in life go on to get the disease, TB disease. So there's a difference between TB infection and TB disease.
Okay, just you were saying that they could have the disease but not show any symptoms, but at that point they're not infectious to others.
They are not infectious to others. They are only infectious to others if they are coughing. Okay. They're not infectious at the time that they're infected. For example, Mary Jane can be infected, but she's fine. Okay, she has no symptoms. So even though she's infected with TB, she is fine. She cannot infect anyone else. John Doe has coughing, fever, night sweats, weight loss. That person, John Doe, is infective to others, can infect others. So he has the disease.
Okay. And what are some of the causes of TB or the risk factors?
Well, risk factors, you're at increased risk for TB infection if you have been exposed to a person who has TB.
Okay.
So a person in the room coughs, has TB, you can get infected. So you're at risk of getting the infection. Okay. Persons who spend a lot of time in congregate settings or institutions such as jails, prisons, group homes, in shelters for the homeless, in inpatient or outpatient care facilities, persons who are living in overcrowded homes, okay, or persons who are living or working in high prevalent TB countries that have a high prevalence of TB. So those are at risk of getting the infection.
Okay.
Now, who is at risk of getting the disease? Now, these persons can have the infection and not have the disease. So they are at risk of getting the disease if they are co-infected, for example, with HIV. Anything that lowers the immune system so that the immune system can't fight off that infection can go on to get TB disease. A history of prior TB that has not been properly managed, properly treated. That is why we pay special attention to getting persons to complete their treatment, because it's a long process. It's a long treatment of about 6 to 9 months.
Wow.
So persons who default and don't finish their treatment, they are at risk of getting TB again. Okay? Persons who recently gotten TB infection, because some persons, their immune system is not strong enough, they get the TB infection and soon after they get the disease. For some others, they get the disease down the road, years after, when their immune system gets depressed for whatever reason. Persons who are substance abusers, for example, alcoholics and injection drug abusers. We don't have a lot of injection drug abusers, but we have a lot of alcoholics. And these are at great risk of going on to get TB disease if they have TB infection, because their immune system is depressed. Persons at the extreme of age, young persons, older persons, the immune system is not that developed in the young, it's weak in the older persons. And towards persons who smoke tobacco. There are also persons who have certain diseases such as diabetes, okay, chronic renal disease, persons who are on steroids, persons who are on some of the cancer drugs, So these are persons that are at risk of going on to getting, and that's just a short list of getting TB disease, okay, having had TB infection.
Okay. And what are some of the complications that come along with TB? I know you listed some of the symptoms. Go over the symptoms again, and then what are some of the complications?
Okay, so some of the symptoms of pulmonary TB, TB of the lungs, would be coughing, fever, night sweats, weight loss, poor appetite, the depressed appetite, fatigue, always feeling tired, feeling weak. So basically, those are most of the symptoms. Now, if it's TB of another part of the body, for example, the bone, then you'll have bone pain. If it's the lining of the lungs, you'll have pain, what we call pleural pain, pain around the lungs. So it all depends on where in the body is affected.
What's the most popular part? The lungs? Or
the lungs. And most of TB would be in the lungs.
Okay, and what would happen if there's a TB outbreak in the Federation? Like, what's the first step, then what's the next step after, like the medical?
Well, really, okay, let's talk about if we get a TB case. Because if we have a TB case, if somebody is diagnosed with TB, we have to treat that person and control the spread of TB. So we isolate the person, we treat the person in hospital, and we isolate that person, so that person is in a room by him or herself, and we don't have what we call negative pressure rooms where that's the air is sucked out, and filtered, but we have rooms that are airy, so the person must be in an airy room, so the air can pass in and out freely. And we treat the patient, we start treating the patient right away with drugs. There are 4 drugs that we use. There are more than 4, but we use 4 drugs, and that is standard practice. That's standard practice all over the world. We start off with 4 drugs, and we ask the patient to produce sputum for us after being on the drugs for a while, for let's say 2 weeks. We ask them to produce sputum. We check the sputum for the mycobacterium.
For those of us that don't know what sputum is, say what sputum is.
Sputum is what we cough up out of the lungs. So we have to check that. Once that sputum isn't free of mycobacterium, then that person can come out of isolation, and go on the normal ward, because that person is no longer infectious. It's only if you're coughing up the TB germ that you're infectious. So if you're no longer coughing it up, you can go among other persons. You can go back on the ward. When we're satisfied, you can go home. So you don't have to stay in hospital for the 6 months or the 9 months of treatment, just until you're no longer infectious. Then, along with treatment, we have to control, which means we have to do contact tracing. So we have to look for the persons who have been around that person, whether it's at work, at home, socially, and we offer them a test to find out whether or not they are infected, whether or not they were exposed, whether or not they're infected, and we can then offer them medication to prevent them later down in life getting TB disease.
So for the coming off of what you said, so for the 6 to 9 months of treatment, let's say somebody is actually has the disease, for that 6 to 9 months they're in the hospital?
No, they're not.
Oh, okay.
No, they're not. They are only in hospital until they are no longer infectious. And we have a way of monitoring it. We ask them to produce the sputum and we test it. Because one of the ways of diagnosing TB, if someone comes in and we suspect that person has TB, we have to have the proof. And the proof is, ask the person to cough up sputum from the lungs, deep down in the lungs, and we send that to the lab. And I think that we're going to talk more about that later. And we test that. we look under the microscope and we look for the bacteria.
Right.
And we also send off some to offshore to Trinidad to be tested and also to be cultured. So we try to grow the bacteria. And we check to see if the bacteria would respond to the drugs that we are giving the patient. So we do a number of things in the diagnosis of TB. So once we have and we do chest x-ray, of course, to look at the lungs, because sometimes we see in the chest x-ray cavities, and that cavity is full of the Mycobacterium tuberculosis.
Oh, that's interesting.
So we monitor so we monitor the progress of the patient then that is in isolation with chest x-ray, and we monitor the sputum to make sure the sputum no longer has any Mycobacterium tuberculosis in it.
What if the patient that you guys suspect of having TB does not, they don't have the pulmonary? So what would be, so if the person doesn't have pulmonary TB, would they be coughing up that stuff?
They would not be coughing. So that diagnosis has to be made by tissue. So if we suspect that it's a pleural, the lining of the lungs, then we have to take some of that tissue and test it.
Okay.
If it's the bone, we have to try to get some of that tissue and test it. So it depends on where it is.
Okay.
Okay.
Good evening. My name is Adrian Douglas, and in keeping with World TB Day, I am just going to briefly outline what we do here as a lab in terms of diagnosing TB. First, if TB is suspected in a patient, the patient is being asked to, early in the morning, before brushing, before eating, to cough, and this cough is a deep cough, to bring up what we call sputum. That's the sample we test. Okay, this is done on 3 consecutive days, and the sputum is then taken to the lab. Upon reaching the lab, the sputum is being treated with bleach. That's household bleach, and this is to kill the TB bacteria. The sample is allowed to stand for just overnight to make sure that the bacteria is being totally killed. Okay, and then after that, it is being centrifuged to get a concentration of the bacteria, and from the sediment a slide is being prepared, and then we go and we do a staining procedure. This staining procedure is called the Zeil-Nielsen staining, in short ZN staining. What this does is to identify stain the bacteria, the TB bacteria. It is done in 3 stages. We have the primary stage, which we flood the slide after we have prepared the smear. We flood the slide with carbon fuchsin reagent, stain, and we allow that to stand for 5 minutes, after which we rinse it and then we decolorize it with acid alcohol. If TB is present, what happens, the primary stain will bind itself to the cell wall of the TB bacteria and preventing it from being decolorized when we use the decolorizing reagent, thus giving the name acid-fast bacilli, AFB. After the colorizing stage, we then move on to the counter stain, which is methylene blue, or we can use malachi green. This stains the background of the slide, giving it contrast. So after that, we allow the slide to dry, and then we view it under the microscope. If the TB bacteria is present, the results would be the bacteria will stain as rods, red rods. They can be curved, straight, or beaded. And the background, anything in the background will be stained with the blue stain or the malachite green stain. I'm pleased to say that everything is done here at the lab, and results are available within a few days.
What is our current status on TB here in the Federation?
TB, let me first talk about the Millennium Development Goals.
Okay.
The United Nations, one of the United Nations Millennium Development Goals is to halt and begin to reverse the incidence of TB by 2015. Okay? So that is one of the reasons why we're having this awareness talk, so that persons could be more aware of TB.
Right.
And if they have certain symptoms, a cough, for example, that's lasting more than 2 to 3 weeks, have it checked out, because the cough starts might be dry and then it becomes productive. Okay? And then you might see blood in the cough. All those things should alert the person and say, you know something, I heard about TB on the TV. I wonder if I have TB, let me go and get myself checked out. Okay? Or I have been around somebody with those symptoms, let me go and get myself checked out. But coming back to the number of cases, we have seen a decrease in the number of cases on Nevis.
That's good.
I did some research, and in 1969 we had 13 cases. In 1970, 12. In 1971, 11. In 1972, 15. In 2001, we had 1 case. In 2003, 1. 2008, 1. 2009, 2. 2010, none. 2011, 1. 2012, 1. 13, none. 14, none. And in 2015, so far, no cases. So I think that we are in Nevis, we are meeting the Millennium Goal of reversing, halting and reversing the incidence of TB. And this is 2015.
Right.
So by 2015, we have done that. And by 2050, the Millennium Goal, we want to eliminate TB as a public health problem to less than 1 case per million of the population.
That's good.
So we have, in 2013 worldwide, there were 9 million cases and 1,500 deaths. So basically worldwide we have a lot of work to do. The world is small, so persons come here, we travel, we can get exposed when we travel, we can get exposed when persons come here, so we have to keep it in mind. We can't say that TB is no longer here and that is not even on our radar. We must keep it on our radar.
Okay. And those numbers sound really good. Okay. So thank you, Dr. Nisbett, for the insight on TB and the symptoms and the treatments and all the other wonderful information we got on TB. I will now go over to Nurse Jeffers, who's going to give us some info on the different tests that are done for TB, or the tests that we do on TB.
Good evening again. My name is Ermin Jeffers, Community Nurse Manager at the Charlestown Health Center. Now, at the Charlestown Health Center, we do a Bantu test, or it's PPD. And this is a test that is done to ascertain whether or not the person has a positive or negative reaction to TB. How the test is being done? It's done by, we usually do it on a Friday at the Charlestown Health Center. And the site for the test is the flexor surface of the forearm. And we usually use the left arm. At first, we clean the area using alcohol swabs, and then we allow it to dry, after which the vial in which the tuberculin is in, we usually wipe it to make sure the area is clean, free of any germs or anything like that. And then we insert the injection, we withdraw 0.1 of the tuberculin that is inside the vial, and then we give it intracutaneously. After giving it, a little bleb will appear, which will disappear in a few minutes, and then the person is allowed to come back to the health center to have it read in 48 to 72 hours.
Okay. And how important is it for one to do the mantle test?
Very important. Well, this is done usually for persons who are seeking like work permit in Nevis.
Okay.
Yes, and also sometimes we have students coming in who are supposed to be going away for university studies, and that is usually recommended by the college. So they usually come in and have it done.
Okay. And I know you mentioned that it's done at the Charlestown Health Center. Is that the only health center on the island that
Yes,
does
that's
it?
the only health center on the island. Yes, Charlestown only.
And any specific times for it to be done?
We do it all day Friday. We do it on a Friday every week, all day.
And the results come in to so it's 2 working days after, 2 to 3 working days
It's
after?
48 to 72 hours, so we do it on a Friday, and then we have them coming in on the Monday,
Okay.
where we will read it, and then we give them the result to take to their doctors.
Okay.
So as Nurse Jeffers said, the mantle test is extremely important. It's important for persons who have the infection. That is the only way we're going to know if they have the infection. The disease, we do other things. Okay, like the sputum and the chest X-ray and so forth. But for the infection, remember, they have no symptoms. So that's the only way that we're going to find out if they have the infection. So, like Nurse Jeffers explained, we do the injection into the arm and we read it at a later date. Now, we do the screening in addition to the persons who are coming into our island, because we want to know if persons have the infection, and we want to know, we want to ensure that persons can get treatment if they have the infection, and then our TB burden would not increase. Okay, so in addition to those, we do it for persons who have HIV. Okay, because persons with HIV are more prone, because of their immune system, to get TB. And persons, okay, so we do that for HIV persons. We do it for healthcare workers and lab staff, because they have been exposed. They never know who coughed in their face, okay, so we do it for them. We do it for prison inmates, because remember I said in congregate settings it might have spread of TB. We do it in the elderly persons in like elderly homes and so forth. Anybody who is otherwise immunocompromised, like persons who may have chronic kidney disease, or they are on long-term steroid use, they are more prone to go on to get the disease, so we want to know if they have the infection. And household contacts of persons or other contacts of persons who have been exposed to TB. That is very, very important to do that. That is why I spoke about contact tracing. So when we're doing the contact tracing, because someone in the home has TB, that is what we do. We do the mantle test. Okay? And if they react to that test, then we have different measurements. Okay, more than 5 millimeters, more than 10 millimeters, more than 15 millimeters. We know how to interpret these, and we decide whether or not that person is at high risk of going on to getting TB disease, and we can offer them prophylaxis. That is medication to prevent them down the road getting the disease.
Okay. Now, I guess either you or Nurse Jeffers, I wanted to expound a little bit on, so when they give the injection for the mantle, so when you leave, are there any precautions that you're told not to do to this arm and that kind of stuff?
Well, usually what we tell them, they're not supposed to like scratch.
Okay.
Even if it's itching, try to avoid scratching the area.
So what happens if you do scratch the area?
They might have an adverse reaction whereby the area might become swollen, more swollen, and the like bumps, that the raised area might extend over a wider area of the forearm, and that will in turn give us a wrong reading.
Okay. And what was the limitations for the wrong reading? Like how many centimeters would you say, okay, this person might be exposed to the germ?
Well, usually, if a person comes in and we read it and they have a reading up to 5, not 5, 10, once they don't have any prior exposure to anybody with HIV infection or tuberculosis, then we consider that to be within the normal range.
Okay. And anything after 10
yes,
is a red flag. And if you happen to take the test on Friday and you accidentally, I guess, you didn't pay attention, you scratch it, and your reading is more than the 10.
What we usually do, we still read it, but what we do, when we are sending the result back to the doctor, we will put a note.
That it was irritated.
Yes, that patient was scratching the area or something like that. So at least the doctor can know what happened. And
how soon after you took that test can you take another test? Was it?
Well, we don't give it under a year. We don't give another one under a year.
Okay. And let's talk about immunization. What is the name of the immunization that's given for TB, and give us some insight on it?
Okay, the name of the immunization that is given for TB is the BCG vaccine, BCG meaning Bacillus calmette-guerin, and this is a vaccine that is used to protect against tuberculosis. That is, it's prepared from a live attenuated strain of Mycobacterium bovis.
Okay. What exactly does it do?
Well, it provides immunity or protection against tuberculosis. It triggers the immune system to protect against tuberculosis, giving very good immunity to those who receive it. And it also protects babies from serious forms of tuberculosis, such as tuberculosis meningitis, which is an infection of the brain.
And in what form is it given to the patient?
Well, the BCG vaccine is a freeze-dried preparation that comes in powdered form. Okay, and before it is used, it must be reconstituted. How? The powder also comes with a diluent. Diluent meaning solution to mix it. It's usually normal saline. So before giving it, we have to reconstitute, mix both together, and then the vaccine is given to the child, baby, or whoever. However, this reconstituted vaccine must be used up within 6 hours of opening. If not, we have to discard it, because it cannot stay longer than 6 hours, because the potency of the vaccine won't be the same.
Oh, okay. So what age is it normally administered to?
Well, here in the Federation of St. Kitts and Nevis, we usually give it between 0 to 4 weeks. However, there are some contraindications to giving the vaccine. So if we have a child coming to us who has like febrile acute illness or any febrile conditions, we withhold it until a later date. Okay, and also the BCG vaccine is not usually given for children or adults between the ages of 16 to 35, but if because of the type of work that they do, they are in some way compromised, like especially here healthcare workers, then they can have the vaccine.
So what's the reason why you can't give it to adults that age of 16 and up?
Because the vaccine, it don't really work well for that age group.
Oh, it's better to give it at a younger age?
Yes.
Oh,
It don't work well for those persons who are 16 and over. And also, there is no evidence that is effective in those who are 35 and over. No evidence whatsoever.
So once you didn't get it at a younger age, you don't get it at all. So you just have to be careful. Okay.
That's right. And we used to think long ago that it lasted a lifetime, but there's no more evidence now to say that it wanes after a while. So even a child, you get it as a baby, by 20, like let's just say after 35, it doesn't work well. After in the 20s, it wanes. The effect wanes.
Okay.
So it's no longer as effective as when it's a child. So it's effective to prevent childhood disease,
Right.
but it's not that effective after. It wanes after a while.
Like I said, but for persons who are between 16 and 35, whose work put them in occupational risk of tuberculosis, then they can still be offered the vaccine.
Okay.
Such as healthcare workers, like I said before.
And where on the island can one get the BCG?
BCG vaccines can be had at each health center in Nevis
Okay.
and all the health centers in St. Kitts as well.
And can you get it at the hospital or just the health
No,
center?
just the health centers.
Okay.
And another thing is that BCG, interestingly, also protects against leprosy.
Oh,
Yeah, so
that's interesting indeed. Okay.
Might I add how the vaccine is given?
Sure.
Okay, it's 0.05 mil, right? And it is injected in the dermis, which is the top layer of the skin, and we usually give it in the right arm. So that's the right upper area of the arm. So in effect, it's given intradermally. As healthcare workers, we usually give it at the same site, so that if we are going to look to see if someone had their vaccination, we know where to look.
Right.
Okay? So if we are giving it in the right upper arm, we'll automatically go and look at the right upper arm to make sure that the person was vaccinated with the BCG vaccine. When the BCG vaccine is injected, a small raised lump will appear. It's like an orange peel at the injection site, and this usually disappears in about maybe half an hour. However, after about 2 weeks, a red ulcer will appear, and it will develop into about a 10 millimeter little bump, and after another 2 weeks, this will go away, and then the vaccine now will heal, and then you will have this scar on your arm, which will be about 5 millimeters.
And that's what you use to tell if the person
Yes.
has it already? No.
This is the sign that the child was vaccinated.
Okay. And is it painful for the person that's receiving it?
Yes, it is. Yes, it is, because it's the injection going into the skin. So, yes.
And while it's healing, like when you have the bump and stuff like that, is it itching and being irritating? It's irritating?
Not really, but most of the times, it like the babies we really vaccinate, so we won't really know if it's itching really, but I don't think it causes much of a problem.
Okay.
But we usually advise, after giving it, we usually advise the parents not to do anything with it. Don't expose the area in which it was given for the next 24 hours. We also tell them not to bathe the area, and do not put anything on it. If they see it form into the ulcer that I spoke about, just leave it like that.
Okay. And you haven't had any complications when it comes to that vaccine, right?
Well, not really. However, If it is given too deep, because remember I said it's supposed to be intradermal. If it is given too deep, like subcutaneous, it can cause an abscess. But we don't really have much of that. Okay.
Okay, well, this whole interview has been very informative, and I would like to thank you guys for coming. Before we close off, I'm going to ask each of you if you have any last words of advice or anything you want to say to the public on tuberculosis. So I'm going to start off with Dr. Nisbett.
Well, just to say that we need to be aware of it, not to think that we have eliminated it from Nevis. So we need to be aware, know what the symptoms are, and we are having less and less cases, and for that we are thankful, but we must be aware, and that is why we are having this program, so that persons can educate themselves and keep on top of things.
Well, as I was speaking about BCG, I would just like to let everybody know that vaccines are given to induce antibody formation in the body and give specific protection against targeted diseases. In the absence of protection by vaccination, these diseases cause high morbidity, mortality, and disability. Right? Especially in infancy and childhood, but also throughout the stages of their life. So, as a result of that, it is very important to have your children vaccinated. Thank you.
And that was a very informative and interesting interview on tuberculosis. And we had this interview on tuberculosis because today, March 24th, 2015, is observed as World Tuberculosis Day. And remember, the theme is Reach, Treat, Cure Everyone. Each one teach one. If you have information on it, you learn a lot of stuff from this interview. Share it with someone else so we can all be aware of tuberculosis. We're trying to get the numbers down. Even though our numbers in Nevis are really good right now, we can still do better. And I would like to thank Dr. Nisbett, who is the Medical Officer of Health in Nevis, for being here and giving us some insight on tuberculosis, as well as Nurse Jeffers, who is the Community Nurse Manager, for giving us some insight on the different tests and the vaccines that are done for tuberculosis. Thank you both for being here. That has been this week's edition of Health Matters. I am your host, Shevanee Nisbett, Health Educator at the Health Promotion Unit. Thank you for listening. The fruit of the week is orange. Orange is a good source of vitamin C, so try and eat at least one orange every day this week. Have a good evening.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.